All right, good. So at the top, we are talking about women's wellness and health maintenance. And these are the top 10 concerns. Heart disease, which is the #1 killer in both men and women. Then cancer is there. Number 2, you have strokes, diabetes, which goes along, obesity. Many people, I'd say 80% of obese people will have diabetes, but it's not all, it's not 1-to-1. It's close, but it's not. You have osteoporosis, which is loss of your bone mass as you age, and that's primarily hormonal. And you have depression. Depression is a big concern of women for a lot of reasons. Autoimmune disease, lupus, multiple sclerosis, rheumatoid arthritis, inflammatory bowel disease. 70% of autoimmune disease is in women, 70%. Menopause. We talked about andropause in men last week. Now we're going to talk about menopause. A lot of people know about menopause, but your symptoms and the sequela of menopause, which one of them is osteoporosis and more heart disease, we can abate that with bioidentical hormone therapy if you qualify. And then for the younger women, we have family planning, which is a concern, when to have a baby, what proper contraceptives is available, and then we have sexual health. So these are the top 10 health concerns. You can Google it, you'll see it. These are the big ones. Okay, so I'm going to get into each of these a little bit more, and then I'm going to go into what you should be doing when you go to see your doctor, what he should be doing to maintain your health. Okay? Any questions before I start?
I have a few, but I'll wait until you finished each point before I ask the question on that point.
All right, Mimi. All right, risk factors for heart disease. Everybody should know them. Smoking, high blood pressure, high blood sugar or prediabetes, diabetes, high blood cholesterol, and obesity. Obesity is a risk factor for heart disease. More than 1 in 3 American women will have some form of heart disease. That's a third. And heart disease is a leading cause of death, as stated for both men and women. But the good news is that through prevention, again, this is why I'm such a big preventionist. We don't have to just live this faith of, well, we're here in America, and we're just going to eat badly, and this is what's there, this is what's new, this is what's vogue, this is what everybody else is eating. If you don't want to be a statistic to become one of those people who die of a heart attack or a stroke, then you want to do something different. So good diet, exercise, not smoking, and restricting your alcohol. You can have alcohol, just don't become a drunk, right? All right. Cancer. When you think of cancer in women, most people think about breast cancer. It's a top concern of women. Women over 40 should be screened with annual or biannual mammography. We have genetic testing. We use a company called Natera, and they will test. You can get a blood test and get tested for the breast cancer gene, otherwise known as BRCA, BRCA1 and BRCA2. If you have that gene, you have a 40% chance of developing breast cancer. That's quite a high percentage, right? But most cancers will be episodic or just sporadic, so you should still be screened. If you have a first-degree relative, that would be a sister, a mother, or a daughter that has cancer, you should be screened, and genetic testing should be done. Skin cancer is the most common cancer, not breast cancer. You should know that. Skin cancer is obviously more prevalent in fair-skinned people, not darker-skinned people. We get cancer too. It's just not as prevalent. Lung cancer in smokers, colon cancer.
When I have to do an NSF for a check in the DCR.
Okay, can you please mute? That's Jax. Hi, Jackson. That's Jax Dotson. Please mute. I was saying colon cancer, which you should be screened with colonoscopy after the age of 45. And uterine cancer, it's common. Those are common. If you add all three of those cancers up, you equal breast cancer. So breast cancer is still the most prevalent breast cancer, but these other cancers are common as well. So you should perform monthly breast exams. You have to learn what you're doing. You know, you should be taught how to do a breast exam by your physician, because many people don't know how to do it. Most masses are going to be benign masses, mostly fibrocystic, thickening breast tissue. But that's why they recommend the mammography. If you're younger, they'll do a breast ultrasound, because some of it will just be cysts. You should wear sunscreen no matter what your complexion. Protect yourself from too much sun if you're going to be out there on the beach, just getting rays. Don't smoke tobacco. Get your colonoscopy when it's indicated. Certainly, if you have rectal bleeding, it's a time to get checked. If you have black tarry stool, it's a time to get checked. Those could indicate that you have cancer. Okay, and abnormal periods, you know, women have to get their pap smears and on a regular basis, starting at 21 every 3 years, and then you know, and most of it clears because the virus that causes cervical cancer.
Hello.
Hi. I'll let you in as soon as I see you pop up. Okay, so that's cancer. That's number 2.
Quick question, Dr. Christie, before we move on.
Mm-hmm.
I wanted to backtrack to heart disease. I saw an article just came out about artificial sweeteners can heighten heart disease. And so most of us do drink a big cup or maybe 2 cups of coffee a day. What would you recommend is the best sweetener to implement into our liquid beverages to kind of help prevent the heart disease and or diabetes?
Yeah, when they say they say artificial. So artificial would be NutraSweet, aspartame, Splenda, or sucralose, saccharin. All these things, they're artificial. The natural sweeteners have not been linked with, number 1, weight gain or cardiovascular disease, and that would be stevia and monk fruit. Those are the 2 that I recommend. I don't recommend honey, especially if you're on a keto-like program, because it's got a glycemic index almost as 1-to-1 with sugar. So it's just it breaks down into sugar. I don't recommend agave. It is a natural sweetener, but if you see the way they make it now, they add all the stuff in it, and it's also too sweet, and it does turn into sugar. Stevia does not turn into sugar, and monk fruit doesn't do the same. Okay, so that's what I recommend.
Could you spell the second one in the chat?
M-O-N-K, monk. M-O-N, monk, like a religious monk. Fruit. Yeah. Okay, let me get through this. So strokes. Now, what causes strokes? You can either have a bleeding stroke, which is bad, right? And that's usually from high blood pressure or popping an aneurysm, or you can have a blood clot coming from your lots of places, right? Any kind of clots from the heart primarily. So we want to make sure that we are making sure our blood pressure is controlled and that we're not in a hypercoagulable state. lots of birth control pills, if you're on them, will put you in a hypercoagulable state. All those birth control pills, you know, the risk for blood clots is there. And so you don't want to set yourself up for a stroke. Every 40 seconds, someone in the United States will get a stroke. Every 40 seconds. Every 4 minutes, someone will die of a stroke. Big concern here. I'm going to talk about autoimmune disease, but 60% of all strokes occur in women. Know the warning signs. You remember FAST, droopy face, weakness in the arm, numbness, speech problems. So most of these risks are controllable for strokes. I talked about the heart, the high blood pressure. Those are mostly bleeding strokes. And then you have the blood clots, usually from, you know, being on some form of birth control or estrogen like medications. And then some people have high homocysteine levels, which is genetic, that makes themselves more prone to strokes. So know your blood pressure, keep it in a healthy range. It's preventable, okay? I just had a fella I saw this morning, first brand new patient. He came in with kidney failure and he had high blood pressure for 20 years, got headaches, all the warning signs, some headaches, some dizziness, a little blurred vision every here and there. And then he went in and got his blood work checked finally, and he was in kidney failure. So now he's getting dialysis for the last 3 years. So it's definitely preventable, guys. You know, we just have to make sure we're doing everything that we know in our hearts that we need to do. If you're not feeling well, you should get checked. Okay. Now, obesity. This is why, you know, everything ties into this. Obesity can lead to high blood pressure. It can lead to diabetes. Diabetes can lead to heart disease. High blood pressure can lead to heart disease and stroke. So you see the thing, they're all connected. Usually, obesity goes hand in hand with diabetes, type 2 diabetes. It's an epidemic in the United States. 26 million people have it, and half of those cases are women. We know that obesity is a risk factor for diabetes. So we don't want to be obese. It's not healthy. Even if you think it looks good, it's not healthy. It leads to everything else. So the combination of heart disease, strokes, and kidney disease, these things, you can prevent them with healthy lifestyle. All right, so welcome to the 12 Weeks to Wellness Lifestyle Change Program. You get out of it what you put in it. Okay, so most things are preventable. Okay, so now osteoporosis. So let me say now, after saying that about obesity, do you know that obesity is actually protective in developing low bone mass? But that's not the way you want to do it. You know, and say, well, I'm just going to protect myself from getting osteoporosis and getting bone fractures, so I'm going to stay heavy. No, but it is, because the body is sensing that pressure, and so the bone stays strong to carry you. So obese people typically don't have osteoporosis. Frail, usually Caucasian, Japanese women, small people like that, they get a lot of osteoporosis. We get it too, Black women, and you know, get it, but it's not to the same extent that you would see the majority folks that I just mentioned. So 1 out of every 2 women will experience osteoporosis in their lifetime. It's a silent disease. It starts long before the problem develops. The earlier you start protecting your bones, the better. So when a woman, it peaks, your bone strength peaks at age 30. So you want to make sure that you're continuing the things that you need to do to keep your bones strengthening, like exercise, weight bearing exercise. You know, weights is good for that, but walking, that's a weight bearing exercise. Obviously running, but I don't recommend it if you're overweight, because then you can develop more arthritis, which is different than osteoporosis. You basically wear out your joints that way. And you should take calcium and vitamin early on, and vitamin D early on. We don't recommend taking a lot of calcium and calcium replacement later on after your postmenopause, because it just kind of sits there and can cause calcification of your organs. So you want to build up your bone early in life so the bone mass stays. And then you want to continue with strength exercises to maintain it. Okay? You should do a bone density test. And it's really not recommended until you're 65. But if you have risk factors, we recommend doing it as early as 40, 50, getting it done early if it runs in your family. Any questions about that osteoporosis before I move on? Okay. I hope I didn't confuse you about the protective effect of obesity, but it is. You will hardly see any obese woman with osteoporosis, porous bones, weak bones. So depression, it's more than just having the blues every now and then, right? So it can be genetic. It can have some environmental impacts, some psychological factors. So, and especially throughout the pandemic, you know, we saw a rise in anxiety and depression. But if you've been depressed or down for more than 2 weeks, you need to see your provider. We can do a quick depression analysis and get you started on treatment. With me, you won't get an SSRI, but you'll get exercise, you'll get meditation, you'll get herbal products, things that help to increase your serotonin and your feel-good hormones. Now, I'm not one to throw people on an antidepressant, even though if they're suicidal for a short period of time, you know, you may want to do that, but I'm still not big into that.
Dr. Christie, is ashwagandha a good herbal?
For depression?
Yes, sir.
Not really. It's ashwagandha is an adaptogen. It's good for stress. So if the stress is causing you depression, yes. But in terms of directly affecting the serotonin levels, maybe not. And then, you know, I can see if my naturopathic doctor online, if she knows better.
Yeah, I would agree. It kind of gets touted as a, you know, it does everything, but I would not be using ashwagandha for that. It is an adaptogen. There are more effective things that we have in the office. We have mood balance. There are other things that we can give that have more efficacy in that area.
Correct.
I find that in women over 40, holy basil tends to work wonders. I see 5-HTP, very good. Miss Gwen is a very good one as well. That's in the formula for mood. So there's a variety of things. Maybe ashwagandha is not the best for that situation.
Yeah. Yeah, somebody just asks, is 5-HTP good for depression? Yes, and monk fruit, aka Luohan Gur extract. I guess if that's the Chinese name for it.
It is. You all can find it at the Asian market under that name. That's what it is. It may be a little cheaper at some of the international markets, but yeah, that's what it is. It's an extract of a fruit.
Awesome. All right, now let's talk about autoimmune disease. 75% of the people who have autoimmune disease are women. It's where the immune system goes haywire and it starts attacking yourself. There is over, at last count, I think 120 autoimmune diseases. The big ones that you would have heard about would be lupus, Hashimoto's thyroiditis, rheumatoid arthritis, inflammatory bowel disease in the form of Crohn's disease or ulcerative colitis, sarcoidosis, which affects primarily the lungs, celiac disease from gluten enteropathy, multiple sclerosis, Graves' disease, another thyroid disease, et cetera, et cetera, et cetera. So why does this happen? You know, you can read anything about them. They won't tell you a cause. They just say, well, it just happens. But integrative physicians, we have our theory and it seems to work. It all comes from what you're putting in your body externally. Stress affects the immune system. Stress produces cortisol and adrenaline. Anything that causes a leaky gut, from an infection or just inflammation or just the immune system going haywire, those, when you eat food, those food, when they go across the leaky gut membrane, can be recognized as foreign. An antibody is produced. That antibody cross-reacts with your lungs, your heart, your brain, your joints, and that's the theory that we have for autoimmune disease and why it happens. Any organ can be attacked, and it really has to do with the immune system is lined with gut immune cells called Peyer's patches, and those lymphocytes are what's producing the antibodies. So you have to keep your gut healthy, and you do that by managing your stress, having good probiotics, keeping the bad bacteria out from growing in with probiotics, digest your food properly, eat good food, not GMO food, not processed food, and you can keep your body in tune and so it doesn't fight against you. Your immune system has to be intact, and when it goes haywire, it's because of the environment, okay? But 75% of women, 75% of autoimmune disease happen in women. That's 3 out of every 4 cases. And I have lots of patients with it. Okay, menopause and perimenopause. It's a fact of life that as you age, you will go through menopause. Your ovaries will stop producing the hormones that it produced when you were younger, and you will stop getting a cycle. You can either accept it, live with the hot flashes, the night sweats, the mood swings, the low libido, the memory loss, and the inability to sleep, or you can do bioidentical hormone restoration, manage your stress properly, and feel better well into your 80s and 90s. So what they found is that women, like the Japanese women, they have very, very mild symptoms because they have a higher diet with, they have a higher diet filled with soy because they eat a lot of soy. And I'm trying to mute whoever is not muted. Okay, thank you. Yeah, so that is a big problem that can be fixed. I fix women every day who are in those stages of life, and they're happy. You just need to find a good anti-aging doctor who does this thing and knows all the pitfalls and all the benefits, and you can get your groove back. All right, family planning. Get rid of this screen here. So
Quick
when,
question, Dr. Christie, what would you suggest for women who are going through that or starting to go through that and you realize that you're not sleeping? I know there's melatonin and things like that, but what would be the healthiest thing? Because not sleeping could cause stress, other things when you wake up the next day. So what would you recommend to get a good night's sleep?
yeah, well, you have to manage your stress, and you should be getting exercises during the day because then when you're tired, you'll sleep. There's also herbs that I recommend for women who cannot take bioidentical hormones, but I'm going to get into some of those herbs a little bit later in the talk, so you'll see what I'm talking about. Okay. All right, family planning, for the younger women who are trying to get pregnant or don't want to get pregnant, that is a big issue for women. I'm talking about the top 10 concerns again, and this seems to be one of them. And then sexual health. Sexual health, a lot of times it's from bladder issues. Women will have what you call female sexual disorder. If they've had babies, when they've gone through menopause, then the vaginal dryness, the dyspareunia, which is painful intercourse. They also have inability to climax. All of that is important as you get older, but if it's not important to you now, then you have FSD, female sexual disorder. It's because you're supposed to want to have sex. If you don't want to have sex, then you have a low libido and something needs to be fixed. If you're just tired of yours, I've had enough sex for my life, I don't need it anymore, then you need to come and see me because it is certainly, sex has so many health benefits, you would not believe it, okay? For overall well-being. Okay. Functional problems, urinary, talk about that. Some of these things will happen when you have hormonal imbalances and menopause. When we treat menopause, we usually fix your sexual disorder. At Anwan, we have the FemiWave, which is the acoustic wave therapy, where it's sound waves that we use to regenerate the vagina, vagina. So, and then we also have the O-shot, which helps as well. So, you could do the hormone restoration, you can get 90% improvement. You do the FemiWave for maximum fulfillment. And here's a FemiWave. It's acoustic wave. It's an FDA cleared device, 6 to 12 treatments. It can be combined with the O-shot, obviously with hormones, and we recommend not to be on anti-inflammatories as well. So you're a woman, say you're 40, 45, 50, 55, 60, and you come to see your doctor, but you don't know what to tell them. These are the things that you're going to make sure that the doctor is doing for your annual health maintenance. Okay, he has to take a good history. He should ask you about smoking, because we know what that does. Find out how many drinks you're having per day or per week. Find out how your relationship is, your intimate partner violence. Is somebody kicking your butt every day? Are you in fear of your life? They need to check that out. And then they need to do a depression screen. It's really just 2 questions that they have to ask you to screen you for depression. If you're younger and you're looking at having babies, then they should be able to talk to you about getting your body ready for childbirth. There's another question there. Okay. Melanie had asked, is there any alternative to treat to treat autoimmune disease? Or you're saying is CBD an effective treatment for autoimmune disease.
For autoimmune, yes, that's correct. Is that an alternative?
I don't think so. I mean, you know, it in a way, it's like an adaptogen. So if you're managing your stress properly, then your immune system is going to behave better. But you really want to work on your gut, making sure that your gut is healthy when you have an autoimmune disease. It can shut down those antibodies from being formed that are attacking your joints, that are attacking your brain if it's MS, that are attacking your thyroid. You know, I've done detoxes on people and healed their gut, and they've had thyroiditis, and it just brings all that PTO antibodies come way down. So a lot of it is lifestyle, but CBD, I mean, I use CBD for sleep and for pain. I've never used it for an autoimmune disease.
I use it primarily for symptom relief, Ms. Blake, but not as a curative. It's kind of as an adjunct, as Dr. Christie said. It does lock into CB1, CB2 receptors that can help modulate and mitigate pain. But I don't think that it's a curative in that way. It can help you with some of your neurological symptoms, you know, in autoimmunity, but I think that it's an adjunct to some additional things.
Thank you, I understand.
All right. So high-risk sexually active women should be counseled to reduce their chances of STDs. Adults should be screened for obesity, so you should get on the scale. You can't say, well, I just don't feel like weighing in today. They should check your blood pressure. They should check your cholesterol level. They should do a questionnaire to check to see if you're at risk for heart disease. If your blood pressure is greater than 135/80, you should also be screened for diabetes. If you're overweight, you should also be screened for diabetes. Women 55 to 80, they recommend taking an aspirin. That's what the ACIP, the Preventative Task Force, recommends. I don't recommend that, but this is what they recommend. And if you're not intolerant of a baby aspirin, you know, they're saying 75 milligrams. They usually come in 81. You can take it if you feel you're at risk for a stroke. Better keep your blood pressure under control, keep your weight under control, take omega-3 fish oil that thins the blood as well. So that's safer than taking an aspirin every day. But if you've had a heart attack or you've had a blood clot, taking an aspirin is something good. But if you've not had any of those, then I don't think you should be on it. It's recommended by the ACIP. They should screen you for osteoporosis at the age of 65. And in younger women, if they've had fractures or they have higher risk. There's a fracture index score that they can put, it's called a FRAC test that they can put you through to see if you can get a bone density earlier. But yeah, that's how it goes. And then your immunizations, I do believe in immunizations. You should get those. I don't know about all these COVID shots, because you know the COVID vaccine doesn't really stop you from getting COVID. But you know, after you get the first two, getting all these boosters to me just seems like a waste of time. And everyone should be screened for depression. Very, very common. So the two questions are, over the past 2 weeks, have you felt down, depressed, or hopeless? If you say no, over the past 2 weeks, have you felt little interest or pleasure in doing things? You should say no. Those are two correct. If you have one of these are yes, then you have to do the 9-question one. And then if you test positive with that, then you should see a behavioralist. Okay, we talked about the cervical cancer screenings that needs to be done at age 21 and on. You can stop at age 65. But if you're still quite sexually active, you should continue. There's nothing wrong with continuing to check because HPV can be transmitted at any age. That's the virus that causes cervical cancer. Breast cancer screening, I talked about, starting at 40. If you've had someone in your family that had breast cancer in their 40s, you should start at 30s, 10 years before. All right. Okay. Cancer, this is old. I should have changed the slide. It's now, this age has gone down to 45 because of all the people who are dying of colon cancer in their 40s. So now they're recommending this to be 45 and even 10 years sooner if you have it in the family, if someone in the family has had colon cancer in their 40s. All right, so here's my topic, menopause. This is what happens. It can start as early as 38 and it can start as late as 55. The ovaries basically say, I'm done. I'm just going to put out a little bit of stuff now. I'm not going to put out eggs anymore. You get reduced libido, mood changes, hot flashes, bone disease, osteoporosis, and heart disease. So it's not just by going through menopause, you're just worrying about the sexual function. When women go through menopause, their risk of heart disease shoots up because that estrogen that was protecting them from heart disease is now gone. So when you get on replacement, you reduce your risk. So that's one reason. Plus, it helps with your bones. All right. So it's important to, if you qualify, you don't have a major risk like a first-degree relative with cancer, breasts, or uterus, you should be on bioidentical hormone restoration. Okay, so it says here now the risk of heart disease is 2 to 3 times higher in women postmenopausal than premenopausal. So you see that estrogen and progesterone was protective, but women catch up real fast in terms of with men and heart disease. After the age of 65, a third of women will have some form of heart disease. All of these are just reasons why we need to treat menopause. We shouldn't just accept it. Okay, so these are the women who qualify for bioidentical hormone restoration. You want to make sure you're checking their risks. First-degree relatives who've had cancer. You want to make sure they have a mammography to, before you initiate hormonal therapy, a pap smear. You want to check their family history. You want to check their menopause score sheet. Some women will come up and they complete our score sheet and it'll be 60, 80. Some women will come, they'll have minor symptoms and it'll be a 20. But nonetheless, it needs to be treated. We use pellets, estrogen and testosterone. We use creams, gels, injections you can get weekly, and capsules with progesterone, DHEA, pregnenolone, DIM, melatonin, evening primrose oil, and then the adrenal adaptogens. I think we have some of the best adrenal adaptogens from Orthomolecular Lab. We get great results with it. Excellent for stress management. If you take it, it doesn't do well sitting on your shelf. I like fishing. So you're taking your adrenals. Yeah, I bought them. Buying them and taking them is something different. You got to take them. Adrenal support in the morning, adrenal stress at night. That helps. And then you're dealing, I've been doing this stuff now for over 30 years. So this is one of my specialties, hormone restoration. Keeps you young mentally, physically, sexually. All right, so by race, African-American women are more likely to have hot flashes than white women, Hispanic women, Chinese women, or Japanese women. Hispanics will have more vasomotor symptoms than other ethnic groups. Japanese, as I mentioned before, they eat a lot of soya products, so they have a lot of phyto plant-based estrogen in their diet. So they usually don't have bad hot flashes. So here is something that I think all women should be taking once they reach the age of, say, 35. DIM. I discussed this actually at my last staff meeting, but it comes from cruciferous vegetables. If you're going to eat broccoli, Brussels sprouts, kale, cabbage, cauliflower, one of those every day, then you don't have to take DIM, because the compound DIM, diindole carbinol, methane, comes from the vegetable, the cruciferous vegetables. And it's good because it helps to balance the estrogen. You know, you hear talk about estrogen causing cancer. You have good estrogen and you have bad estrogen. The bad estrogen becomes hydroxylated rather, by chemicals and in the liver. So you want to make sure that your estrogen is going to the beneficial form, not the potentially harmful form. So that's why DIM is so important. It also increases progesterone secretion, so it balances estrogen, so women don't get that premenstrual state. You know, this is the first thing that I would take if you get PMS, tender breasts and all that, and mood swings before your period, DIM. So studies have shown that it prevents breast cancer, uterine cancer, colon cancer, and in men, prostate enlargement. And it's definitely beneficial in treating PMS. We have it in our office. Every woman that gets on hormone has to take DIM. They have to promise me Scout's honor, and they take it. This is all the good stuff that's in it. It's got DIM. It's got another compound that converts to DIM called I3 carbinol and vitamin E. This is the DIM plus. The plus is the vitamin E. So there's lots of clinical trials being done on DIM to treat breast and cervical and prostate cancer. And then the benefits of vitamin E is there. It's the most effective form is the alpha tocopherol form. And so it's been shown to inhibit cancer cells. The next women's supplement I want to talk about is evening primrose oil. So all women should be taking DIM after the age of 35. Right? You just want to keep your estrogen balance. And then when you go through menopause, then you consider hormone restoration. But evening primrose oil also has lots of good benefits. It's got this gamma-leolanic acid. It's like fish oil. It's an essential oil. And it helps with quite a few things. I use it mostly for breast tenderness with women who have pellets. And sometimes once the estrogen level goes up, they'll get the tenderness. It's good for cramping if you have your period. It's good for nerve pain, like diabetics can get. So it's something that I would recommend if you have any of these ailments. Evening primrose oil. It's been around for centuries. And it's because of this GLA, the gamma-leolanic acid, that all the benefits come from. Okay. It's been shown to help with migraine headaches. So if you get chronic migraine, this is a natural way of treating it, is to take it. But I think for this, you would have to take it in a preventative mode, just take it on a daily basis. It comes in a capsule. It looks like fish oil, but it's evening primrose oil. It's a different essential oil, gamma-leolanic, not DHA or EPA, which is what the omega-3s are. Okay. Diabetics, this will help them with their nerve pain if they get peripheral neuropathy. They say it helps with osteoporosis, and definitely in combination with DIM, it helps with PMS, menopause, endometriosis, and fibrocystic breasts. Supplement number 3, you had asked Mimi about what you can take. I use a lot of this for women who are in the perimenopausal. They haven't gotten to menopause yet. They're still having periods most of the time. Sometimes they start skipping some until, you're not in full-blown menopause until you don't have a period for a full 12 months, 1 year before you're menopausal. So this is a good supplement to start with because it's got all these plant-based phytoestrogens: black cohosh, red clover, dong quai, chasteberry, licorice, and soy. And it had these wonderful vitamins and minerals as well. We call it female support or femme support. Some women take this, they don't want hormones. They're like, oh, my hot flashes are gone. My night sweats, oh, I'm sleeping better, everything. They just feel better with it. So I love this product and I use it a lot. And then I get into some of the stuff that each thing is. But, you should know that soy is a subtropical plant. And, Asian women, the reason they don't get hot flashes, as I said earlier, is because they eat a lot of this. But it's not the GMO soy that we have here in this country. You need organic, natural soy, not genetically modified, because soy in this country is very allergic. You have a lot of people allergic to soy-based products here, and it's the way it's made. Genetically modified organisms. Yeah, it's not all bad, but anything that's GMO, wheat wasn't all bad, but now we have GMO wheat. Everybody now has gluten allergy or gluten issues because of what we did to it. The black cohosh is a plant-based botanical that has estrogenoid properties. So you can take it up. Even the American College of OBGYN recommends it. Red clover is an isoflavone. And then dong quai is obviously a Chinese herb, and it's good for that as well. Has effect on estrogen. And this all of those are in this one product. So you don't have to go out and buy 5, 6 different things. Just take the femme support, and that eases you in to menopause. Oh, I have 3 minutes. Did you guys enjoy that?
That was really good.
Yes.
Thanks, Doc.
Thank you. Thank you. Now I'm going to open up the floor. You can just you can type your questions if you want. I don't know why people are so shy. I think when they were giving out shyness, I didn't stand online.
My question I typed was the products that you just went over. Do you have a website we can order it from and have it delivered to our homes, or do we need to come to the office to pick these up?
No, it's available on our site at anwanregencenter.com. And you can go into any office. You don't have to come to the Regenerative Center for that. We have the products available in all the offices. So non-Regenerative Center members also take our products. Yeah, I came out with these. We've been pushing supplements in Anwan since 2004, and we private labeled since that time. So it has our logo on it. We have years of experience, almost 20 years of experience with these products, and they work for the most part, but you can't buy them and put them on the shelf. It doesn't work on the shelf. You got to put it in your body. No, this is not soda. Right, Rob? Right, Dr. Ward? This is water.
It's not soda.
No, it's not soda. All right, I see Natalie Pickett says, is the FEM support good for women that are postmenopausal? Absolutely. I would recommend hormone replacement, but let's say you had cancer in your family, any other GYN cancers, I wouldn't go on hormones. This is a good substitute and it's safe. One in the morning, one at night. Any other questions? Come on, this is on
I
tape.
feel like this is a question that should be asked while I'm in the doctor's office. But one thing I've noticed, I'm going to be 43 here in a few weeks, but I've noticed that I can't sleep because I wake up because there's no blood flow to my arm. So it's like you wake up and you're shaking and you turn over and it's only my arms. So
Stop sleeping on your arms.
You're compressing your neurovascular bundle by
Yeah,
sleeping on your
somebody.
side.
It's either your husband is on your
So-
arm or.
Right, there is a
you're on it.
side sleeping pillow that I might suggest for you. And it has great efficacy to stop you from compressing your neurovascular bundle.
Mhm.
I didn't have this problem before I had a breast augmentation. And so, you know, a lot of women with breast augmentation, you feel like you're going to pop your boobs. So you're like, let me sleep a certain way. Or after you've had them in for so many years, you feel like, well, I need to have some type of support so they're not like falling to the depths of the earth. So that's why I've slept like that for so long. So thank you for that recommendation. I really appreciate that.
If I were you, just to make a recommendation, I would check Kohl's first, Amazon second, and make Bed Bath & Beyond your third option for it because they're a little pricey.
Okay, last chance for question. I'll take one more. Melanie, you don't have any questions, Dion? Not today?
Ladies, and the gentleman who's here. It's a first question that I ask when I have a naturopathic visit is, do you feel a connection to your vagina? This is very important. I know we've run the gamut on cardiovascular disease, you know, hormonal support and the like. Here's the thing. If you are not having interaction in your vagina, it leads to other things down the road, right? Incontinence, stress incontinence. You have to tonify the vaginal floor. Now, one of the best ways to do that is through orgasm. I mean, that just is it, right? And if you're doing sex right, you're burning calories. It's increasing your dopamine. It's doing all of these things for you as a consequence of your health, physical, mental well-being, and it strengthens your relationships. So it's very important that we get these affairs in order as it relates to us and our health, and having full connection with, you know, our vagina. So necessary for your wellness as a whole.
Speaking of sex, can you, have you ever seen, let's say husband and wife have been together for 20 years, but have you noticed women saying that I feel like my husband's semen is causing my vagina to be unhappy, if that makes sense?
Yeah. So the vaginal pH is very fickle, and Dr. Christie can attest to that. Although he's a man and he doesn't have a vagina, he's seen the gamut of it, right? But our environment can be easily switched in the presence of semen. If we're talking about women who are still in childbearing, there's a certain acidity that the vagina must possess, right? It's the bleaching effect that should be happening when we wear our panties. The vagina should be acidic under the guise of ovulation. When, you know, we're preparing the womb for a baby, we go more alkaline. But depending on your husband's or, whomever's semen that's being disseminated in there, it can slightly change the vaginal pH. There are things that can be done to restore it. Probiotics are going to be helpful in this area, right? Because there's a resetting of the the flora in your vagina that is important. Another thing is that you need to be on these probiotics, some of which that are feminine geared, even our multi vitamin and the like are helpful in these areas because we're all adults in here. There can be oral sex as a consequence of changing the pH balance in a woman's vagina. And so I tell my patients, make sure that your husband or partner's oral hygiene is in order, right? Because when they kind of disrupt that environment, that can cause your pH to be quite disturbed. So checking those things, making sure that you have all of those things in check will be beneficial. And there's nothing that Dr. Christie has not heard or seen under the face, of women's health. So don't be shy about these things when you go to your appointment. You have to be honest and frank. So, the clinics can best serve you.
Yep. Well said. All right, guys, it is 2:05, so we've been on the air now for 1 full hour. So I'm going to bid our farewell, and then we'll see each other again next week. Same bad time, 1 o'clock, I think, on Thursday. So make sure you're eating well, you're getting your exercise in, and you're doing either your fat burn or semaglutide, or I think a few people are on fentanyl too. So let's get it. Let's get the weight. I'll be asking weight loss next week. Take care.
Have a blessed day, everyone.
Bye-bye.